Okay, we're here today to talk about treatment of anxiety disorders and obsessive compulsive disorder. So I just want to show you where we are in your clinical site notes packet. You should have already done the activities to learn about all of these different anxiety disorders and obsessive compulsive disorder. And now we're over here in the far right-hand column talking about treatment. So I just want to make the point that, like some of the other psychotherapies and biomedical treatments that we've talked about, this therapy, for example, rational emotive behavioral therapy, developed by Albert Ellis, is not used only for the treatment of anxiety disorders, but can also be used for treating major depressive disorder and obsessive compulsive disorder, among others. I just put it here because the fact that this type of therapy really works to challenge our irrational beliefs and behaviors, it pretty well lines up with generalized anxiety disorder, because a lot of that is based on very unrealistic beliefs and interpretations. The goal of rational emotive behavioral therapy is to recognize our faulty beliefs, our unrealistic beliefs, and our unrealistic goals for ourselves, to really question the rationality of these beliefs and these goals, and then help us replace them with more valid ones. So an example being, somebody who says, I should be successful, I should always have an A, people ought to treat me fairly. REBT really challenges people to look at the rationality of those kinds of thoughts and to try to come up with more realistic expectations for themselves. The next set of therapies that we're talking about are all behavioral therapies. So they are mostly rooted in classical conditioning, which we learned about earlier in the year. It started with Mary Cover Jones in 1924, who did the opposite of John Watson. If you remember John Watson from the Little Albert scenario. Following John Watson's conditioning of a phobia in Little Albert, Mary Cover Jones decided to desensitize a fear that already existed in a little boy named Peter. So by using direct conditioning, by pairing something that Peter was afraid of with something that he liked, she was able to condition that fear out of him so that he now associated the thing that he feared most with something that he liked. An example of this used now today in a more widespread way to treat phobias is something called systematic desensitization. Systematic desensitization, sorry, this is my fourth screencast of the day, is a form of counter conditioning that pairs a trigger or some kind of stimulus that elicits fear with a new response. Relaxation, which is incompatible with fear. It operates off of the idea that the nervous system can't be both anxious or aroused and relaxed simultaneously. So for an individual who is going through systematic desensitization therapy, the first task would be to create what's called a hierarchy of fear. So let's take, for example, someone who has a fear of spiders, or not just a fear, a phobia of spiders. Okay, so for this individual, seeing a spider even from afar can elicit a very immediate and severe arousal of the nervous system, like a very intense, irrational fear. So the creation of a hierarchy might look something like this, where they are first picturing the least threatening version of that stimulus, which might be a spider, a picture of a spider across the room. What's next? Well, now I'm going to picture myself holding, or I might actually hold a picture of a spider. Now I'm going to watch someone dangle a spider in front of me, then put it on their hand. Then eventually I'm going to get to the point where I can maybe even pick it up myself. And then I might even, this is a small spider, I might even be able to eventually be around big spiders. So the creation of this hierarchy from least to most anxiety-producing event is paired with the development of relaxation techniques. So the idea is that as patients work their way up this hierarchy, that each time they get to a new step, they are not advancing to the next step until they are completely relaxed. And what this is doing, again, is counter conditioning. It's having this individual learn to associate the thing that they fear with being in an incredibly relaxed state. So they come to associate the thing they fear with a relaxed state. They're no longer aroused. They're no longer fearful when they are around the thing that before they had a phobia of. Okay, so this can be done both in vitro and in vivo forms, meaning initially the client might just imagine the stimulus and eventually are exposed to it in person. Flooding is a type of exposure therapy that instead of gradually introducing someone to something that they fear, they will expose the person to the phobic object immediately for an extended period of time. And the idea behind this type of therapy is that fear is time sensitive. It's not going to last forever. So in exposing someone directly to the thing they fear, take someone who has a fear of dogs, like just putting them in the room with a dog. That would be an example of flooding. The idea is that over time, that fear would subside and the person would naturally, their arousal would become less and less, and they would eventually become relaxed. So again, this is not nearly as systematic or gradual as the previous approach that we talked about. Another type of classical conditioning therapy is aversion therapy, and this is sometimes used for smoking cessation or for people who may be alcoholics. And this involves pairing a tempting stimulus with an aversive or an unpleasant stimulus. And if you're thinking back to how classical conditioning works, you actually see it right up here, right? So our unconditioned stimulus being a drug that elicits an unconditioned response of nausea paired with alcohol. So they would place a nausea-inducing drug in a person's drink so that drinking then elicits nausea, so that eventually they would learn an association between the alcohol and the nausea-inducing drug, so the alcohol itself would elicit a conditioned response of nausea. Moving away from the behavioral therapies for treating anxiety disorders and so the psychotherapies, if we're talking about REBT as well, now we're going to talk about anti-anxiety medications. Many of these medications, like Valium and Xanax and Ativan, are benzos. They depress the sympathetic nervous system, and they increase the inhibitory neurotransmitter GABA. Do you remember our mnemonic device for GABA? Go away, bad anxiety. Oops, sorry. So in increasing the inhibitory neurotransmitter GABA, you're decreasing the parts of the brain that are involved with anxiety. These are acting as minor tranquilizers. Now, concerns with anti-anxiety medications are that they can be highly addictive. These are not for everyday stress. It is typically recommended that they are accompanied by psychotherapy, because the criticism is that in prescribing these drugs, you're treating only the symptoms and not really resolving the underlying problems of a person's anxiety. So because they're addictive, they need to be prescribed very carefully. When stopped, they can cause withdrawal. And all of the medications that we've talked about so far in this unit should never just be stopped cold turkey. Your healthcare provider always needs to be weaning you off of one of these drugs. Okay, so that brings us to our last thing that we want to talk about today, which is treatment for obsessive compulsive disorder. Okay, so again, CBT can be used, REBT can be used. There are certainly other, and as well as accompanying medications, can be used to treat obsessive compulsive disorder. But I want to introduce another behavioral therapy similar to the other behavioral therapies that we just talked about for treating anxiety disorders, and this is called exposure and response prevention. So this type of therapy would have an individual approach the object that they fear, or kind of that is the source of their obsession. So for an individual whose obsession center around exposure to germs and dirt, they would expose them to germs and dirt, but not allow them to indulge in their compulsion. So, for example, they would soil their hands, but not allow them to engage in the normal hand washing compulsion that the person would do. So what they're learning here by exposing them to germs and dirt and not allowing them to go through the compulsions, they're learning that there's actually no negative consequence that results from being exposed to germs and dirt. The person is not going to get sick simply because their hands are dirty or they've been exposed to germs. Another example would be, instead of walking into an apartment and adding mail to a pile, which might be characteristic for someone who's hoarding. Hoarding disorder is another disorder that is in the category of OCD and related disorders. Instead, they would sort, place the junk mail in a trash can while being comfortable about letting it go. So again, this is just another type of exposure therapy where individuals are learning, in this case, that there's no negative consequence that results from not doing the compulsive behaviors that are characteristic of OCD.